Okay, so we're back, and I was a little cut off on the last topic. So I wanted to pick up with puberty and the psychological effects of time. It turns out that it matters whether you are earlier or later than your peers, or whether you're a boy or a girl. If you're for either sex, if you're pretty much on time with the rest of your peers, puberty is a pretty simple process to go through. But if you're significantly early or you're significantly late, your sex will impact what kind of effect you get from that. So, for example, when you're significantly earlier than your peers, so you have girls who are developing breasts much younger than their peers, their hips are wide, they've reached menarche significantly earlier than their peers, you have oftentimes poor body image that can be that. A lot of times, girls who start to physically mature feel like, well, first off, they often report that they're fat, is what they say. And like I was mentioning in the last video, one of the big things that happens at puberty for women is the addition of fat to the chest and the hips and the thighs and other areas. And so, for a younger girl who's surrounded by peers who haven't started to put on that body fat yet, it may make that girl perceive herself as fat. She may see herself like that the rest of her life, even though she's not. She may have a very negative attitude about her breasts, for example. Sometimes they attract a lot of attention. And so the boys not knowing what to do with a girl whose body is starting to mature often will tease her and make her feel very bad about her body. And historically, that's been really common for girls to get teased for the way that they look. They're maturing early. It can lower their self-esteem and actually trigger some depressive symptoms. So earlier maturing girls have some negative outcomes. So whereas for boys, we see some signs of behaving too maturely for their age. Like people are treating them as if they're older and they should know things they really don't know. Because they're bigger, much more aggressive. And because they sort of feel more mature, people regard them that way. A lot of times they will push the envelope on like breaking law, like that. They might start to use alcohol and other substances much earlier than other kids their own age. So you have sort of the girls internalizing negativity about their bodies, whereas the boys oftentimes are externalizing the behaviors that can get them in trouble. Now, if you're later than your peers as a girl, most common outcome of that is feeling self-conscious. Girls who didn't need a bra when their peers needed a bra, or who haven't had a period yet, everybody else is having theirs. They just feel self-conscious about it. Like sometimes don't want their peers to know or are afraid that others might be judging them. They're just self-conscious, not the complete negative we were talking about earlier. We talked about the early maturing girls. Boys who mature later tend to display lack of confidence, so they're anxious. They're more likely to be depressed. They're more afraid of sex. So boys who mature later have more negative outcomes. Girls who mature later, girls who mature earlier have more negative outcomes as far as internalizing things than boys, and boys who mature earlier have more externalizing problems. Boys who mature on the average time scale. So it really matters sex and then position. The happiest place for everybody is to be right on time with everybody else, but we can't all be there, right? Because we have all these factors that determine consonant. All right, let's talk a little bit about it, because you know what, this is the biggest concern of most adolescents. There are so many bigger problems that they should be worried about. Their biggest concern is their skin, their hair, weight, their muscles or lack thereof, and all these things, their height. So teenagers, adolescents are very concerned about their appearance. So boys, things that would make them happy would be being all ripped, right? They think this is what men are supposed to be. Attractive men will look like that. For girls, they think the attractive women will look like that. So themselves to high standards of, well, in both cases, low body fat, right? And for the boys, they're supposed to be super muscular, and the girls are supposed to be teeth and small-waisted clothes. they don't want their boys to be perceived as not strong, you know, pale, things like that. That's oftentimes see that as negative. And for girls, their biggest, worst fear is that. That's the most common concern that girls, especially in early adolescence, express. So kind of see kids internalizing messages got from a variety of sources. Girls on average report less satisfaction with their parents than boys report about theirs. Boys seem to feel a little bit more confident. Even boys who are a little bit overweight tend to, it's not as troubling. Being big is equal for boys. So any amount, whatever causes bigness is okay with them. Whereas for girls, they're very critical about their hair and weight, everything. So media influence really has a lot of impact on girls. Today, we have to include in our media influence YouTube videos where people who do their own YouTube videos to show you how to put on makeup or how to do hair or whatever, those are influencing girls to they should wear their makeup like that or make their hair look like that or whatever. And so media includes those sites, those kinds of individuals. But I mean, the worst case kind of media influence is kind of get through mass media where they have to fix even the most beautiful women to make them beautiful enough. So I linked in our classroom on campus the Dove commercial that takes this very beautiful woman and then makes her better. It definitely gives you the impression that it's not good enough, right? Like she's not even good enough. And unfortunately, girls look at magazines, the model's body actually looks like that. They may be aware in the back of their mind that Photoshop is part of it, but it doesn't occur to them that the kind of Photoshop you see in this Dove video really occurs. And so they think that it would be possible for their hair to look like that, or their eyebrows to look like that, and they don't realize that actually this girl's hair and eyebrows don't even look like that. So media absolutely has. Boys have an influence. Boys oftentimes, through adolescence, express a preference for thinner girls. They often are more, I want to say ask out, that's the correct term, modern, more attracted to girls who tend to be thinner. And so it gives girls who aren't that sort of stereotype ideal shape the impression that they would not be attracted to. So girls strive trying to be that ideal. Girls are more prone to depression after puberty, and part of it might be, hormonal changes. Boys are going through hormonal changes also. Their depression scores don't change as much as girls do, and so one interpretation is that girls are just more likely to feel inadequate, that they're not whatever standard, and that they internalize that. So here's what research has shown. That those people who, during adolescence, report that they feel like they are attractive, tend to, in adulthood, higher self-esteem and report being happier than people who, when they were adolescents, said that they did not feel attractive. So it feels like there's an important job for people around adolescents to do to protect their sense of feeling attractive. Criticizing kids for how they look, especially that there's nothing they can do about it. If a child is starting to get talking about it all the time, it's not helpful. Or a child who's going through the growth spurt, so feet are big and legs are skinny and like that, commenting on it doesn't help. They're going to grow out of it. There's no point in saying anything about it. And when it's time for them to get new pants because their pants got too short because their legs got too long, there's no need to give an excuse for why the kid needs new pants. You say, you know what, let's get you some new pants. And often we comment on things and kids really internalize it. My daughter insists that she was younger. I said something about her ankles being thick. And that doesn't sound like anything I would say, but she heard it. So I must have said something that gave her that impression. And, it just tears at my little heart. I'm like, I don't know what I'm so sorry. I don't know what I said. And it made her self-conscious about it. So we have to be kind of a little bit careful. They're a little more sensitive than usual about their appearance during the stage. I have no idea what I said, why I would have said it. But apparently I said something. Speaking of appearance being the biggest concern of adolescents, health concerns, good news is this is a really healthy time. So it's a good thing that adolescents are on average very healthy because they're not very concerned about their health. They really have low rates of disability and chronic disease. Problems they have are mostly preventable. So they're not very concerned about their health, but then they engage in some behaviors that might put them at risk. Smoking, drinking, using marijuana, things like that. These are things that could undermine their health, like in some really drastic major ways, drinking, driving, becoming addicted to smoking, things like that. Or it could give them habits that make it more difficult for them to be able to achieve their goals in life, smoking marijuana regularly, things like that. So mostly it's preventable things. They start to engage in sexual activity, and it's very common in adolescents to have first kisses and different kinds of things, but you start involved in sexual activity, it can lead to some pretty significant impacts. You can catch sexually transmitted infections. You can become pregnant. So these are things that a lot of times kids are not really about or worried about, but they probably should. They're bright, they're mostly healthy, they do some behaviors that could impact their lifelong health. Here we have a chart that shows boys in the blue flying the girls in red, shows the percent of U.S. 9th and 12th graders who say they have sex. And what we see is that overall lines are trending downward. Actually, the girls have kind of come up to meet the boys, so it would have been nice if they kept the girls on the trajectory the boys were on, where it was going down. They've met by 2009 at the same goal. We are having the lowest rates of sexual activity among teenagers that had past about 50, 65 years. So kids are waiting longer to have sex, and they're doing other behaviors that don't necessarily lead to pregnancy, for example. And so those are good. So those are help maintain their health longer. Take away some of those behaviors. If we look at the leading causes of death among adolescents aged 15 to 19, this is data from 2006, you'll notice that the absolute most common cause of death among this age is unintentional injury, accidents. A lot of it has to do with them making a bad decision and getting hurt and mortally wounded. So you'll notice the other kinds, and then homicide, suicide being the next most common. That will kill us in adults are not really here yet, adolescents. So adolescents get taken out of the population through a lot of things that are decision-based. Now, if you compare what teens are concerned about versus what parents are concerned about for their teens, you'll notice the list on the parent side looks a lot more like the list I just gave you. Whereas the teens are concerned about parents, you see that it's the second one, stress and nervousness, it feels like there's a lot to cope with. And then they're worried about acute infections like having mono or flu or something like that. They're not really concerned about the big things they might attract, some of the things that they're engaging in. So it's kind of interesting that the teens are like absolutely not focusing on the same thing that adults worry about for teens. And so they can end up the exact same thing that we were concerned about for them. Nutrition, looking at the ordinance, just seems like I spelled it wrong, but that's correctly spelled, nutrition. During puberty, we do need more food. And then, that old stereotype kid who's going through puberty is just so hungry and is eating everything. It's true. Caloric needs increase. Boys need about 2,800 calories per day during puberty, and girls need about 2,200 calories per day. Later on, girls need less than 2,000, and then boys need something around 2,500 once they pass through. But during this period of time, their caloric intake is higher. However, obesity is, always looming for adolescents. be called obese, we're talking about a person whose skin fold measurement, so not their weight. I mean, our bodies are all designed slightly differently. Some people might weigh more than another person, and it might be due to bone density or muscle mass or other things. And so just pure weight is not, or BMI, it's not necessarily the best way to assess, how much fat you're actually carrying. So they use a skin fold measurement, and that basically is using calipers to measure how much fat is between your skin and muscles. And having a skin fold measurement percentile is the definition of obesity. And so to flip that, what that means is about 15% of teens will always qualify as obese. What's kind of problematic these days is that on average, teens are getting heavier or having more fat on their bodies anyway. So that 15% of teens who are the top most tier, that top 15%, are actually carrying more fat on them than, let's say, 30 years ago teens were carrying. Because the group is getting larger. So you have to be in the 85th percentile of people of your same age group. Not across time, people of your same age group right now. So 15% of teens may be much heavier than the 15% who are considered obese 30 or 50 years ago. What they know health-wise is that people who are overweight during their teen years tend to experience poor adult health, more likelihood for diabetes, kinds of chronic illnesses, as well as more acute problems like cardiovascular problems and things like that. Even if that adolescent weight is ultimately lost, it's something that seems to carry with. So here's the problem: this is a correlation, and so we don't know if the things that made the teen carry extra weight might be the same things that are causing a poorer health in adulthood, and it's not the obesity is causing the poor health in adulthood. It could be that third variable caused the obesity in adolescence and then the poor health in adulthood. It's independent of weight. It's hard to know. So purely, being overweight is not necessarily a guarantee that you're going to have poorer health in adulthood, but on average, overweight tend to experience poorer health. All right, eating disorders. Anorexia. The definition of anorexia would be the main symptom is that you maintain at least a weight. You maintain a weight that's at least 20% below your ideal weight. You do it through excessive diet, excessive exercise. A lot of times people think that anorexics don't care about food, don't want any food, but they are actually over interested in food. They're preoccupied with it, can't stop thinking about it. They also carry with them a distorted view of their own body. Now, this is not true for every single anorexic, but on average, we have girls who, on the left, here's what anorexic actually looks like. On the right is what she thinks she looks like, which, by the way, that's body over there, right? She looks at herself. She thinks at this very emaciated weight, she's looking normal. So she feels like she has to stay that thin just to look normal. What causes it? There are some media impacts. I put a video in our classroom that shows the influence of its overly thin models on how girls and women internalize that message. To attempt to look like models, you actually have to be really significantly underweight. And so part of it is media influences. But not everybody's affected by the media like that. So you have to say, well, there's got to be something going on inside the person who has anorexia that's different. And things that have been tied to anorexia are having obsessive compulsive disorder. A lot of times anorexics will have like rituals that they always do. They'll have rules about whether they'll eat their peas tonight or not. It's divisible by 3, I will, but if it's not, I'm not eating any of it. They also really suffer from perfectionism. Feel like they have got everything right, and I can't have that on me. That would be perfect. And so this perfectionism often internalizes on trying to make themselves the perfect person with this great willpower and avoid the very thing that their body is screaming out for. Sometimes women with anorexia ultimately it's discovered that they were victims of sexual abuse at some point earlier on. That this might be their way of kind of trying to get control over their own body, have control over it when being sexually abused. So sometimes that's at the heart of it. Something that's related but significantly different is bulimia. Um, this is where you have binges of 1,500 to 3,000 calories at a time that alternate with purges. The most common one you guys probably think of is vomiting. There's also the use of laxatives or the use of diuretics that help to flush out water. So the person will not be caught there with it. Or you can purge through really vigorous exercise. You tell yourself, okay, I ate all this stuff, so now I'm going to run on the treadmill for some 3 hours or something to try and get rid of it. What's interesting is that they usually don't lose significant weight during this binge cycle because you're going to consume that many calories. Some of it's going to get absorbed even before you can vomit or use the laxatives. Get rid of it. And absolutely, vigorous exercise takes a lot of vigorous exercise to work off that many calories. People with this disorder tend to have just like overwhelming negative emotions. In fact, this binge purge cycle kind of illustrates it. So they start off, they're like, okay, I need to lose a few pounds. So I'm going to follow this very strict diet. And then either they slip up, they eat something they shouldn't have, or maybe some other stressful situation arises in their life. Their willpower gets taxed. And that triggers them to enter into the binge eating. They're like, you know what? Like if their diet slips, they're like, okay, well, I blew it anyway. I might as well eat all of the cookies, right? Or they're under a bunch of stress. And they go, oh, I can't help it. I just have to eat some comfort. That triggers this binge eating, this 1,500 to 3,000 calories. Then they realize, oh, now look at what I ate, and now this is going to matter. So then they'll do their purge, trying to avoid the weight gain. The fact that they just now did this dramatic eating followed by this dramatic purging makes them feel embarrassed. They hate themselves for not having better self-control, and then that leads them to say, okay, I'm going to be better this time. And they enter back into strict dieting, and the cycle. So bulimia is a lot different from anorexia because it's almost like it's a control issue interleaved with loss of control issue. So it's a complex disorder. I'm going to take a break here. We'll come back and start with the drug use next segment so I don't wear you guys out.